falling into the middle of it right away. And I think that ambivalence is what causes people to die.
Mm-hmm.
But because their judgment is impaired anyway, of course they're gonna make some fractured decisions.
Well, look like David Ruffin, right? You remember David Ruffin when he walked in that dope house with a suitcase of mega money, and when all the money was done, and when he had overdosed, they brought him to the hospital. They bring him, threw him in front of the door, and they took off. So they have enough in them to, like, they don't want to see each other die, because that tells them about their mortality, like they can die too. Because for an addict, and I've learned that get to the point of where you almost die and get over it is as close to the high that they ever wanted from their first use. So they're always pushing for that little piece of where I almost died and come back. And I say this because, and I share this with you. And my husband's a recovering person. He's got almost 30 years. Like, we talk about that, and he said, he gives me permission to say that. I don't go into other details, but he gives me permission because he's gone around. He's gone around states and stuff and talk about that stuff. He's been on the news and talk about that stuff. So, but I get information from him. Like, what was it like? How did it happen? What did you do? What did how did you get through? How do you stay clean and sober and all that stuff? So I get like little details because I want to understand the addict brain. Why is it they behave the way they do? Why do they act the way they do? Why is it they keep relapsing? What's the difference, between addiction and abuse? Is there a different dependency? What all that means, because I've got somebody who could kind of give me some information from through his experience, and he's done it all.
And a better understanding too.
For sure. For sure.
And he'll tell you about the behaviors that go with it, based on the people he hang around with.
Yeah, sure. Lots and lots of insanity.
Yeah, but it's about, and what people in recovery will tell you, it's the best thing that ever happened to me, because it allowed me to get into a place in my life I would probably have never been had I not been using.
So we're gonna take just a moment, ladies, to make some brief introductions kind of across the board, so that people know who it is that they're listening to. Also, I'm going to hit this wonderful record button here. Excuse me. So that way we're also recording, so that this can become a part of the podcast and things like that, because I do want this discussion to kind of reach all avenues, all panels, because I do feel like it's quite important for us to be having this discussion, for one. And then for two, it's important for us to reach out to a community that is definitely grieving not only the one loss of DMX, but several losses that are due to substance abuse and substance use in general, just in 2021. And we're only in the month of April. That's what I keep saying. So we're really not focusing on the fact that the realities are, we are in the month of April. The year has barely gotten itself kind of off to any start whatsoever. And the number of people dying as a result of using substances, or as a result of getting back in cars and things like that, and trying to drive after they're now under the influence, the number of those people dying has increased astronomically. And a lot of people, I know the CDC is definitely keeping track and kind of relating it to COVID-19, the onset of COVID-19 pandemic, but I feel like it's a lot more than that. So before we do our round table of introductions, I just want to kind of talk about what some of the stats are and the facts according to the CDC. On a timeline track from February 2016 to August of 2020, we looked at the stats of overdoses that are as a result of different types of drugs that are laced with fentanyl, and that's one of the things Tanyetta mentioned, and other synthetic opiates. And you see it climb from somewhere around a little bit over 1,000 deaths to where we are now at almost 10,000.
Yes,
And that's a lot. You know what
it
I
is.
mean? When you talk about it, that's a lot. And the number just steadily increasing. And then we get to 2021, okay, since August, and that number rises and it spikes over doubles. You see what I'm saying?
Mhm.
So we have to ask a very important question. And for those people who are listening, I feel like, you guys have to definitely have a serious conversation. We have to start having more serious conversations around substance use and what that looks like. I think clinically, in our field, we need to be having conversations around substance use treatment and what
Yeah.
that looks like, you know, and how adequate we are as practitioners in delivering client-centered care, truly client-centered care that's to the benefit of the person that we're treating. So without further ado, we're going to do some introductions. Uh, I am Dr. Lakianda Jefferson, and I'm the owner and operator, one of the lead therapists at Familial Bond Psychotherapy and Consultation Services, where I facilitate trainings and also psychotherapy for couples, individuals, families, um, different people suffering with and dealing with persons who are suffering with severe mental illnesses and communication issues and things like that. Um, I feel like it's paramount for us as therapists to also have other avenues to reach consumers and do our due diligence in the community. So I also have life discussions with Dr. Jefferson podcast, and you can pretty much find that anywhere you're listening to your podcast or radio. Um, as well as where else? On the computers, Facebook, and things like that. Also, you guys can find me by just typing in the hashtag doclqj speaks pretty much anywhere on social media and the internet. So next, I will let Sue introduce herself.
I am Susanna Stone. I am in Atlanta, and my agency is Recovery and Consultant to a Different Lens. I work with individuals, couples. I also work with licensed social workers or any social workers or any mental health professionals who's interested in getting their licensure for to satisfy, getting the required hours to get their licensure for the required degree that they're seeking. Um, my focus is usually on trauma and addiction. So that's important. It's important to me because I know there's a big connection between the two of them. When I have seen that over the years in my clients, and we've talked about this as a group before in terms of our concerns as clinician, what we see is happening, and what's going on. Why is there such an increase and a rise in substance use, and even people not making it through their substance use. So that's a topic that I'm interested in talking about, and want to focus my work also on. Thank you.
Thanks, Susanna.
Okay, so I will let Tanyetta go next. And I also want to mention to the audience who is out there listening the fact that both Sue and Tanyetta have specialties in treating addiction. And another thing is that we no longer look at substance use disorder as substance abuse anymore. We look at the usage because it's definitely on a continuum. And I think in the DSM-5, we've changed the language a little bit in the description a little bit. So it encompasses everybody, regardless
Mhm,
of where they are on that continuum. So I
mhm,
definitely want to mention that piece because it's really important that people who are listening that feel like they have their usage under control
For sure.
understand that therapy is also a place and opens up a space for you, whether you've gotten to the point where you feel like you're dependent on it or not. So there's that part. So Tanyetta, I'll let you go ahead and have the floor to make your introduction.
Okay. Well, hello, my name is Tanyetta Ross, and I am the director at Life Enhanced Counseling Services. I provide services for co-occurring disorders and trauma. Here in the Midwest, in Milwaukee, Wisconsin, where right now substance use is at an all-time high. I think a lot of that is mitigated by COVID distress at this point, that isolation from family and friends. But substance use disorder is definitely on the rise in the Midwest. So I'm kind of excited about this conversation.
Well,
Wow.
super happy to be able to bring this to the listeners and to the viewers, dependent, and I know different people are in different spaces or whatever. And for those of you who are coming in late, definitely come in and like and share this content with people, because at the end of the day, we have no idea where people are in their journey and how these different types of conversations can impact those people listening, because you never know where they are in their life and if they're ready to receive something that is similar to what any of these ladies on this panel have to say. So Dominique also, she is a clinical social worker, and she's definitely honing in on working with consumers who are experiencing different types of responses to the loss of DMX and other celebrities, but also she's working with people who are dealing with substance use disorder as well. So I'll let her give you guys her spiel about her. And if you guys are not already following IPCS Indiana or that LCSW Dominique, if you guys don't already know about her, you definitely need to check out her content on the podcast, because I think that she does a really good job in bringing people to a place of relatability when it comes to what's presented on the screen and what is real for them. So their experiences and how they align with some of the personalities and the types of people that we see in different movies and shows and things like that. So yeah, I'll let her go ahead and give her spiel in her intro. She's in Indiana.
Thank you, Dr. J. So yes, my name is Dominique Jackson, and I am a licensed clinical social worker in the state of Indiana. I'm seeking to get licensure in the surrounding states, Kentucky, Ohio, Illinois, and Michigan. But I am the lead therapist and CEO of Inspired Peace Counseling Services. And you can search IPCS on Facebook, Instagram, or Twitter, just searching at IPCS Indiana. So I have some openings right now if anyone in Indiana is needing hours for their seeking their professional license or needing licensure hours. I work with individuals, adults, couples, and families struggling with a variety of issues. I have a background in substance abuse, crisis management, behavioral issues, anxiety, depression, just to name a few. And you can find all my contact information on my Facebook, Instagram, and Twitter, and that's at IPCS Indiana, or you can send me an email at djp@inspiredpeace.org.
Excellent. So to jumpstart the conversation, I think that Tanyetta mentioned the increase in people that are struggling with substance use disorders and the ramifications that come along with that life. So what I want to talk about first is for those of you who have had experiences with family members that are on the panel, and for those of you who are listening and are in the audience, just looking at it from having an actual interaction or encounter with people who have struggled through substance abuse or substance use, and what life was like for them and what brought them to that life. So what was appealing about that life for them based off of what they've conveyed to you. And also, if you guys have been a person who has used substances before of any kind, share with me your experience and what attracted you to it. Because at the end of the day, I want this conversation to be one that normalizes the fact that this is definitely something that's happening. It's a real issue here. But for some people, the outcome isn't always the exact same experience, and what draws you to it isn't always the exact same thing. So either one of you can kind of go first and kind of tell me what you've heard being conveyed from your consumers that you've worked with, and kind of how you help them navigate those issues.
Well, I mean, I could just talk first. I think my interest initially in trying to understand why, why people decided to make a decision to want to try some drugs, or anything that sort of is mood altering. It's just because I have family members that have been affected by it. So I even though I didn't understand the spectrum of it, I knew that I lived in a family that there was an issue. And I knew for some of my family members, it didn't always come out, they didn't always come out of it. People didn't always make it. I knew that. And so I wanted to understand what that was about. How was that? Is that the same as my family members for other folks? So I started to learn about it, and I asked people, what happened. One of the things I have been told over the years is people want to experiment. They usually try to experiment with you hanging out with your peers, and that's where it starts. You hang out with your peers, and then they offer you, and it feels good. The high feels good, and it's like, okay, because I've learned that nobody ever grows up and says I want to be addicted to anything,
Okay.
but
Okay.
I want to enjoy whatever it is. And as the years go by, I talk with my clients about, well, why is it you think you wanted to try? Yeah, it might be peer pressure, but what made you not say no? Because I know for me, I said no because my fear was I didn't want to look like my family members who didn't make it. And so, what I learned from my clients was some of it, they had some issues with how they feel about themselves. They had some issues about things that had happened in their life that was difficult to deal with. And once you tried a particular drug or alcohol, it felt good and you didn't think about it. And it was like, oh, I don't have to think about those problems.
For sure.
So you said, okay, this feels good, and you keep trying it, and before you know it, it becomes a habit and a pattern where we now talk about today as abuse or dependency, and
Mhm.
it doesn't become easy to just stop. And I see people come into treatment trying to figure out, do I want to stop? If I want to stop, how do I stop? Do I want to cut down? How do I cut down? So we talk about harm reduction and risk management. How do we handle that? Because when I started this work 30 some years ago, it was about abstinence.
Mhm.
Today it's very different. It's about recognizing people have choices in how they want their life to look,
For
and
sure.
what us as clinicians and supporters for people being who they want to be, what is it we need to do to help them be there?
Mhm.
And that's kind of really what it is for me, and I continue to do that and support people around being where they want to be, and no longer feeling that I don't have to make the decision on you being clean or sober. That's something you need to do. My goal is I want you to be able to stay alive, but the decision to be there has to be your understanding of the risk you take when you do what you do and how much you do what you do. And we've had discussions about what has happened to DMX, and I always feel heavy when something happens when someone doesn't get through it. Even though I know a lot of the times people who've been abusing for a long time sometimes don't make it, but some do.
For sure.
And if you walk into an AA meeting, you'll see the ones who's making it.
I
And
think that people, go ahead.
no, go ahead.
I think that people use substances for various reasons. I think some people use substances based on peer influence. Some people use substances looking for escape. So it just varies from person to person. But I do think that substance use disorder creeps up in the thinking patterns early in life, right? A lot of times those thinking errors are what lead to the belief that drugs are not going to do me the way that I've seen it do other people, right? Because a lot of times you've seen people in your neighborhood walking down the street with their grandmother's TVs and jumping out of windows and doing all of those insane things. And somewhere in that, people are telling themselves that I won't be affected that way. Right. So clearly there is some thinking distortions, going on right there. I'm going to be an exception to the rule. Right. And so once they've gone down that road, then they've caused so much chaos in the relationships that they have with the people around them. A lot of times using is the only escape from that. Right. It's hard to look at the mess that I've made in the use. And so that's why so many people get caught up in continued use, because it's easier to stay a mess than it is to forge forward and start the process of change. So it's a lot. It's a lot for people. And that's what my experience with the people that I've worked with are dealing with. Just trying to find the courage to say, okay, let me make some changes in my life so that I can clean up this mess. A lot of times they have children that have been abandoned by them. They have family members that have disowned them. Just a variety of different environmental and situational circumstances that make getting clean look challenging, more challenging than the continued use. So it's really hard for people to make a determination to change and follow through. And that's where relapse comes in.
So with Tanyetta, I just want to piggyback on what you said about people feeling like, I'm not too far gone. I can stop whenever I want. A lot of times people are too far gone before they can get help. And that's when you see people selling their TVs and just doing anything to get the high and to chase the high. And sometimes you don't get the addiction the first or second time you use it. So then you think I'm good. And that's not always the case. And sometimes you can get hooked on it the first time you use it. And I'm in Indiana, and it's like it's a smaller town in Indiana, but also where I'm from, it's a bigger area in Indiana. And I will say that the number one reason people begin to use is trauma related.
For sure.
So, and that's the kind of an umbrella for many different things, whether it's, where I grew up in an abusive home and this was my only escape, or my parents were using, I wanted to see what it was like, or my parents actually I've had people who say, that my parents shot me up with this drug. And it's very unfortunate, but it's all trauma based. And it is so sad. And I think that what's going on with DMX, or what happened with DMX is, if you look at some of the stories and things like that, you will see that he went through some traumatic stuff. And the stigma with substance abuse is ridiculous, because you say, well, oh, you shouldn't have used. That's not the point. The point is, how are we as people responding to people who are struggling with these issues? Because a lot of people won't get help based on the stigma related to it. People think that, it's a choice. And while the first time you ever smoke a joint might be a choice, that fifth time might have just been an automatic response.
For sure.
So I think that's pretty significant as well.
Yeah, I'm a firm believer that addiction is a brain disease, right? So anything that is diseased is not working properly. Just like any other condition, like cancer. If you go to the doctor and they tell you that you have cancer, what's expected is that you get some kind of treatment to stay alive. And so in a lot of cases, addiction is a brain disease. There needs to be some treatment in order for people to stay alive. But I agree with you, Dominique. The stigma attached to addiction prevents people from getting that right. Where you have people that are able to get clean. Relapse is a process. That's what happened with DMX. He got clean and he relapsed. It's unknown whether or not he had been completely abstinent or he had found a creative way to use it and minimize the circumstances of use, right? Because a lot of people that use substances go through the process of looking for different ways to do it, right? How can I do it differently? How can I minimize the consequences associated with drug use, right? So I just think that when it comes to people that have gotten treatment services and they've abstained for a while, a lot of times they miss the fact that relapse is a process. It does not happen overnight. People don't just wake up one day and say, "Oh, I'm going to do this today." There's a change in behavior patterns. There's a change in thought processes. There's a change in routines. So there's noticeable changes that precede a relapse, and a lot of times people are not aware of that. There's post-acute withdrawal. There's a lot of different things going on with people that are not using substances anymore. But a lot of times they don't have the information that they need to manage those things. So
some of it is, and that's the purpose of treatment, to get people to understand how their brain works, such that their cravings and the what we call craving, which is the need to want the drug all the time, why that happens. That is important to teach people so that they can understand that, you're not crazy, as we say, that you could make things different. You behave the way you do because this is what's going on in your brain. And we can teach you certain things to think about and to do to make you deal with the craving, so you don't have to use if you don't want to. So we introduce stuff like what are triggers, meaning what makes you feel the need to want to use. And a lot of that's where it comes in when you look at psychosocial issues. What are the stresses that have been in their life?
Absolutely.
Then you start to talk about the trauma, and then you start to talk about the abandonment. Then you start to talk about all the physical, sexual, and all the abuse. And in combination with understanding how the brain works. Because if we don't fix that piece, that need to continuously want to feel different is going to be up there. It's going to be always in the, and we talk about substance use, but it could be the same, and I'll kind of branch out, eating disorder. Loving chocolate, shopaholics. There are those people who have those kind of experience the same kind of feeling or rush of euphoria that the person who uses drugs do, and they go through the same kind of struggle.
I can totally agree, because I struggle with it every day.
I tell my clients that any overindulgence is an addiction. If you cannot control what you're doing while you're doing it, or you're like, it's like almost like zombie-like with the handful of chips, you have an addictive quality or an addictive behavior to that stimulus.
I totally agree. I think that anything that you do in excess to change your mind or your mood potentially reflect a component of addiction, right? The vehicle is just different, whether it's food, whether it's sex, whether it's gambling, whatever it is that makes you feel good. If you use it excessively, then absolutely it's a component of addictive behavior.
Okay,
and a lot of
that's
go ahead.
The one thing I was gonna say is that Dominique's gonna say something too, but let me just say this really quickly. So the thing is, and I know that because I have shared this feed with some clinician groups, and we all know how clinicians can be, right? So when we talk about addiction, we do realize that the addictive component has been definitely removed from the DSM-5. However, when we're talking about addictive personality characteristics and we're trying to help people to understand things,
Mhm.
even usage disorder, what makes things a disorder is the fact that they have a clinically significant impact on the various functional domains of a person's life. And so we're
Mhm.
looking at the fact that even if this thing affects you in a legal way, you still continue to use it.
Mhm.
Even if this thing affects your finances, you still continue to use it. You still continue to indulge. Even if this thing makes you lose your family, your friends, things
For
like
sure.
that, you still
Mhm.
continue to indulge in that thing. And I think that we have to be very, very clear and concise when we say that just because a thing as a diagnostic piece has been
Mhm.
removed from the DSM does not make it a less prevalent issue.
For
Right.
sure.
It just means that now we're expanding the continuum to include people
Mhm.
who are not
Mhm.
yet or not quite addicted to that thing,
Mhm.
Absolutely.
but now
Mhm.
it covers all the bases. You know what I
Mhm.
mean? So it doesn't mean that the DSM, eliminates that this is an issue for people. We
For
Mhm.
just
sure.
expand what it includes or which people that it does include. So I just wanted to say
Absolutely.
that. But go ahead, Dami.
Absolutely.
You know, I got ADHD.
Well,
Um, go ahead, Sus.
you have to, the thing that also stands out about, the drug pieces is that it has life damaging consequences,
For
you
sure.
know, and I think shopping might be a little bit different, right? But it's this behavior has life damaging consequences, and we see it on the news every day. Every day, there's somebody. Look at Prince, look at Michael Jackson, look at Whitney Houston. Look at that whole family got wiped out. Bobby Brown's son, his
For
daughter,
sure.
his ex-wife. I mean, life damaging consequences. And if we don't help people understand how their brain gets affected by introducing chemicals that changes it, then the cycle doesn't get changed.
For sure.
Then if we don't also talk about the trauma that goes with it, then that person's psyche never gets help. And then there is no need to make things different, because once somebody who's been abusing, and I ask my client, once they get it, then they're able to develop coping skills to stay away from using. That's why people talk about they have 20 years and 30 years clean, because they've figured out that, it's not about I don't want to go to jail. I don't want to taste this stuff anymore because it has life damaging consequences for me.
And a
And
lot of
they've
have hit rock bottom. So they, jail isn't a big deal.
yeah.
They've already lost their families.
Mhm.
And the sad thing about the tragedy with DMX is his kids lost him twice.
For sure.
They lost him to the substance the first time when he started using, and they lost him physically.
Mhm.
Absolutely.
And
Absolutely.
You
that's
don't have
that's
to hit rock
difficult.
bottom. You don't have to
No.
hit rock bottom to make some changes in how you feel about how your life looks like without using any substances to deal with the issues in your life.
I definitely think that consequentially people that use substances have to identify what does using substances do for me, and
Mm-hmm.
how, and once a person can identify what it does for me, then I can figure out how to accomplish that without it, right? A lot of times, again, people go through those changes with addiction. If I can just do it differently, right?
Mm-hmm.
If I could do it differently where it doesn't put me in jail, if I could just do it differently where my life doesn't look a mess, and they go through that cycle before ultimately deciding that, this just is not working for me. It's just not working. I think that people that are um fiscally strong, people that have money, like Michael Jackson, Prince, those people don't have all the consequences that lay people have to addiction, right? It's easy for them to do what they do because they got a lot of money to do it. But people that don't have money, they have a lot of consequences to addiction. And that's one of the reasons that people stop, because of those consequences. They get tired of the consequences attached to addiction.
Do
And
you
I think
think
everybody's rock bottom is different.
It is. It
Mm,
is
it
for sure.
is. It is. Right.
Do you think that, when people go through these 12-step programs and things like that, the clinicians that are working with them and peer leaders that are working with them, do you think that these people are not getting adequate help sometimes? Because I have a couple of views on that. But what are your thoughts?
What do you mean?
So many of the clients that I've treated successfully and that have now, been clean after not being able to accomplish that through going through AA meetings and all of that stuff and Al-Anon, going through all of these different meetings and also getting treatment, outpatient treatment, and sometimes partial hospitalization programs, the various works that we typically work up, right? um once they've gotten to me, they're looking for something different because my approach is of somewhat different. And I always talk about people having a very clear and concise understanding of trauma, the big T's and the small T's, having a really good idea of what is traumatic and what isn't traumatic based off of the way that you store your memories, because I feel like that's the easiest way to connect people with what their realities are around traumatic experiences.
Right.
Now, when I treat, I don't use many of the evidence-based practices that most clinicians use. For me, DBT is what works because it's a behavioral therapy that helps to meet people where they truly are, but not only meet them where they truly are, but in a non-judgmental way, help them access the wherewithal to really do a clear and concise assessment of what their conditions are, without feeling judged, right? And so when I've used this approach, I've noticed that it's rendered a tremendous amount of success. And based off of, I went and I looked at my numbers in the system earlier today to kind of just do a good check-in, and I checked in with some consumers and things like that are now have they've not been seeing me because they're PRN now. And I noticed that I've had a success rate of over 860 some odd people
Good
that
stuff.
have seen me for this, and I've not had a single person to relapse yet.
Good.
And I think the longest period of time being clean is 8 years. But for me, when I'm thinking about what is different, I'm thinking of how I start off with those consumers. I'm very curious as to what it is they've tried before, how it didn't work, what was beneficial from those different programs and approaches. But more importantly, I'm very interested in what drives you to where you're ambivalent and your choice is to engage in that thing, whatever that
For,
might be.
for sure.
That's just where I come from. And as a person who has never struggled with using substances at all, right? Not even trying them, not even smoking a cigarette, right? As a person that doesn't have, I'm just not doing that. That's just my mindset. I've always been curious as to what it is that drives the motivation to try a thing that you've seen
For
become
sure.
volatile in other people's lives.
Yeah.
What attracts you to that part of the life.
Absolutely.
And so because I'm curious more so than judgmental per se, I think it drives better results. But I've heard from so many consumers time and time and time and time again, they're like, look, Dr. J, like, I don't want to come in here and you give me this 12-step program because, that shit don't work. I don't want to
Right.
have to do none of this Christian-based stuff. I don't want to be doing I ain't calling nobody to be my accountability, nothing. What am I
Yeah.
calling them for? Telling them I relapse. Like, I don't want that anymore. I really want something that's going to help me figure out what's going on with me that keeps me in this place. And I heard that you can help me with that. And when I hear them say that, what I hear them saying is these modalities are not working.
For sure. For sure.
And so what I see is that addiction treatment specialists, clinicians across the board, we don't have a good enough understanding of the individualized experience of the vast majority of consumers.
Right.
when we
Right.
go in without being curious, but with a plan that's already set into mode, into condition. And that's a very hard thing for those people to face. You understand?
Right.
I agree.
So I'm just curious about where you guys are. Like, how do you feel about some of the approaches that are considered to be the leading modalities in treating addictive disease and things like that when you're treating substance use disorder? Because addictive disease, like we've already discussed, can be a wide array of things.
Correct. Yeah, for sure.
I'll go because I have a different view of treatment itself. I have had people come into my office who have been successful, but I've also had people come in that they were not treated the best.
For sure.
So when you have people coming in and you have a lack of empathy
Yeah,
and a lack of understanding, these
absolutely.
people, when they come in to be treated, most of the time they've thought about it thousands of times and chose to use just anyway, because they didn't think that they were going to come in and get the respect, the empathy, or the care that they deserved.
Totally agree
So
with that.
when I have people come in, it's a lot of rapport building. And this is me speaking to the clinicians, because we have to kind of check ourselves. How is our body language? How are we responding to the individuals that come in? And what do our faces look like when they say, this is the worst of the worst? Like, we have to be ready for that. And we can't just take on things that maybe we have never really helped to treat, because that's a detriment to that patient as well. So sometimes it's not always the modalities. Like I've done different groups and they have been successful, but a lot of people aren't ready to reveal, like they're not ready to peel back the layers.
Absolutely.
And there are a lot of things that are very connected. So, if you're using based on a response of, this makes me, feel some type of way, or makes me feel good, what is that trauma? What's your trigger? What was that trauma response because of? So I don't always think it's just the modalities, but I feel like you have to address your trauma before you can be successful in anything. It's like getting into a relationship and bringing all this trauma baggage. Is going to be a very difficult relationship. Not that it can't work, but it's just going to be difficult because you haven't unpacked. And a lot of the times our brain tricks us into thinking that if we unpack this trauma, then it's going to hurt us and hurt us big. But oftentimes all we have to do is reprocess that trauma with, where we are at this time. And then you can see things get better.
Totally agree.
But I agree with how not modalities, how they aren't for everybody.
Yeah, I agree with that.
It's not always a one size fits all.
No, a blanket approach does not work, because these people are coming from very different places. So I do think that that person-centered care is most important, because I need to know what's standing in front of me and not project what it could be or what it should be. That doesn't work. So I totally agree with Dominique.
Yeah, I do too, because I could just tell you like my evolution through this stuff. Like I grew up when I started this work, we did confrontational treatment, which I have to admit, in hindsight, is really and that's about tearing the person down and building them back up. And somebody may stay clean. I've known people who stay clean and sober because of that. But then when you look at them and you hear how they talk, there's still a lot of anger, there's still unresolved stuff. They've happened to put on the drugs, but the behavior and the thinking how life is has never changed. And so I've gone through that. And for me now, it's about understanding what it is you're looking for. I think a lot of therapists believe that you have to know a lot of substance abuse language and use a lot of substance abuse behaviors and certain kinds of things you have to do to treat somebody who's got a substance issue. And it's really not about that. I have removed, when I talk to my clients, I don't call them addicts. I don't tell them they were a drug abuser, because to me those words sets up a bad message in their brain that they're not okay, because that's what it represents. And then what that does is like, I don't have to get it, I can't get any better because you think of me this way. So I always try to talk to them about what's going on. And for me, it's twofold. Let's talk about what happened to your brain, because that's really important. Let's understand how what you have done has changed your brain. And it's like not your fault. It's not your
Right.
fault what happened to you. You took some drug and it changed the chemicals in your brain and to the point where you are dependent, you become dependent on needing to use this. And that doesn't make you a bad person. I think when you start to tell clients they're not a bad person, that it's okay to feel the way they feel, then they are much more able and willing to want to take chances. I did Al-Anon for 15 years because I wanted to understand how I can break my cycle and understanding my family stuff. My family feels very different to how I feel about the family members in my family who had substance issues. So we deal with that very different. But I know I did Al-Anon so I could understand me and not be able to, when I start to do this work, not bring that in my treatment with my clients. Well, this is what you need to do, and this is what it means, and this is why you drink, and this is why you drug. It's like, you need to let us figure this out. So it's education, and then let's talk about what are the issues that is underneath all this. Let's take a look at that. And then it's not always about AANA, but they have, they're valuable. It's about making different connections so that your likelihood of wanting to not use becomes more and more, and you stay cleaner and sober, and you get to a place where when you run into significant issue, what you don't pick up is the drug. You pick up other healthy skills. That's what we talk about. And stuff like motivational interviewing does help because it allows you to kind of deal with, roll with resistance, because you'll get that. And DBT helps you understand the personality piece, because addiction do have a personality piece attached to it. So, and that's what clinicians get a lot. And then if we don't understand how to deal with that, then we start to give that person name and words attached to them that doesn't fit. You start calling them an addict, you call them a dope fiend. I mean, you hear all that stuff. I've been in treatment. I worked in treatment, many treatment, and those were some of the language. And it's always kind of, it's always resonate with me I didn't feel good hearing that stuff,
Yeah,
you
that's
know? And they didn't feel good because what you get in return was the client getting angry and leaving treatment.
for sure. For sure.
And that might just be one reason why the client left, but the client left treatment. And
I
he
think
or
that
she may come back 6 months later, but they didn't get what they needed because we didn't fully understand what addiction looks like and what's entailed,
yeah,
that we sometimes create additional issue. And the trauma work is not easy to do. And sometimes that's not what you need to do, because not everybody needs to work on their trauma the way we perceive they need to. Not everybody could get to that place. But let's figure out how we can help you understand what happened up here so that we can help you change that with some tools and some steps that you could deal with those issues when they come up, because it's going to be coming up in life, always.
for sure.
The family issues, the abuse issues, and what do you need to do so you don't have to pick up a drug, or you don't have to now substitute. You're no longer drinking and drugging, but now you're gambling. Or now you're having sexual relationship that was different from how your sexual life used to be. That's because people, they can move from one addiction to the next without realizing that that's what's happening. Let's talk about that. Let's talk about why that's related, how that looks like, and what's that about for you. What's the underlying issues for that? And that's what I do. I remove names and famous substance abuse words and all that stuff. We just talk about what's going on.
Yeah.
Mhm.
I think that
So
that for me, I think for me,
go ahead.
CBT, CBT, CBT is my go-to for addicted people because how they think determines how they feel, and how they feel determines how
Mhm.
they engage the world around them. So my thought process is if we can work on that beginning, just to get you to a place of stability right now where you
Mhm.
find courage to make some decisions, then we can address the trauma, right?
Mhm.
I'm already afraid and I'm already unsure because the decisions, my life decisions, have been made by everybody except me.
Mhm.
I can't push you to a place to deal with that right now.
Mhm.
Let's clean up the immediate need, get you to a place of comfort where you can make a decision, even if it's nothing more than just to meet with me once a week. You know what I'm saying?
Mhm.
And give you that empowerment and applaud you in that activity. And as you
Mhm.
grow stronger, then let's address that other stuff. Because I think
Mhm.
a lot of times with substance use treatment, people are addressing that trauma too soon in the game. Like I've only been meeting with this person 30 days at once a week. And now you want me to drudge up all of these traumatic,
Mhm.
and I'm still trying to figure out how to get my feet up under me. You know what
Right.
I'm
Yeah.
saying?
Mhm.
A lot of times that one size fit all
No.
uh, methodology does not work. But
Right.
CBT is
Absolutely.
my go-to all the time.
And it's about I sort of understand when somebody comes in, right? They coming in, they still got all this stuff in their system. They
For sure.
can't focus,
Hmm.
and that's why it's important. That's where you give education, and the expectation is not that they're gonna start spilling out all this stuff about them, but you educate them about understanding substance. Because believe it or not, some of your clients don't fully understand the chemical piece of, of that stuff. So you get them education, you talk about the brain, you talk about how the brain gets hijacked with the substance use, and
For sure.
as they get the stuff out, the drugs out of their system, you can then move to another phase. um the
Right.
trauma stuff comes much later. Let's start to take care of the medical stuff, because they come with a lot of medical issues. Let's begin to address some of that. Let's look at
Right.
that before we even start to talk about what's underneath all this. They
Right.
may need medical detoxing kind of stuff. Let's look at all that stuff.
For
Um,
sure, those
but I think
comorbidities.
that Dr. Jefferson, part of your question was, you know, clinicians who are interested in doing this kind of work do need to have some understanding of what the addiction is and the process of how that works. And there are ways to learn about that. There are ways to get information and to get certification and understanding that, because if your client's been in and out of treatment, they already know some of the things. They already know, they just don't know how to stop. But they
Yeah,
know a lot of stuff. they
that's
so if
true.
you don't understand it, then you are doing them a disservice and helping them move to the next stage
For
of where
sure.
they
I
need
call
to go.
So
Hmm.
it.
so do you
Mhm.
guys think because I think that now so many people have this has resonated in a different way with people finally, because now people are sitting, in a place where they're like, oh shit, people can die. Like
Mhm.
once a thing happens time and time and time again, and it starts to really hit home with these people that we've idolized on the screens
Hmm.
and we've watched for so many years, even if it's happened in our family. Like once these things start to happen in insurmountable amount of numbers in close proximity to one another,
Hmm.
I think what happens for people is that it resonates in a different way, and it sits with them in such a way that creates more of an expanded view of possibilities. Like we could die from this, but they only
Mhm.
look at the this that we're focusing on. And that's a lot of the issue that I have with um, the clinical science behind all of it. So the CDC, we keep statistics on how many people die as related,
Mhm.
related to substance use and things like that, but it only tracks maybe like five of the leading opiates. So we have cocaine, heroin, you have barbiturates that are
Between.
tracked now, and even the anxiolytics that are tracked. Like they're not, we're not looking at it in a more of an in-depth way. You know what I mean? And of course, ETOH, so alcohol. When we're
For
looking
sure.
at these, I think the only reason that people are tracking these is because they're like, oh, well, people are coming in more often to be treated from these as a result of using these drugs. And I think that we need to take a more expanded view. And I commend them for now tracking the stats around cannabis, because so for so long people had normalized the use in their mind, and they're like, you know what? Well, nobody ever died from smoking weed. Not
Mhm.
understanding the chemical ramifications inside of the brain, the neuroscience behind using substances and
Mhm.
exposing yourself to certain lifestyle habits, I think needs to be conveyed to the public. And I think that now is the time for us to have that more deep conversation with people,
Mhm.
just lay people who aren't clinicians, clinicians who are struggling with addiction themselves,
Mhm.
doctors. Like I know I've had coworkers that I've worked with and I've seen them. A lot of people don't know what it looks like behind the scene, going through med school and going through residency and stuff. And it's a
Mhm.
lot of stuff that we see um and normalize it, because it's like, oh,
Mhm.
residency is hard. We have to work these 18 hours. You got to be up for this amount. And they're, oh, we're just using this to keep ourselves up. Things like that. We
Mhm.
hear these excuses and we hear people normalize it like that. And it, after a while, it becomes something that's really acceptable. And that's how I feel cannabis has taken its
Mhm.
acceptability. But we've also noticed that, and I don't know if other people are really paying attention to this, but we also have noticed that there are more mass shootings in this year that's only been 4 months into than
Mhm.
we've ever experienced in the United States across the board. We've had more people died from mass shootings. You understand? That's the big
Mhm.
piece. And we've had more
Yeah.
just crazy crimes that nobody ever thought about committing. People just killing their neighbor because they had a disagreement, shoveling snow. Start thinking about some of these things. And in every single one of these cases, every
Substance.
single one of these cases, there is a history of cannabis use. Nobody's looked into that, because people are like, oh, well, it was just their distress. It's just COVID-19 response. But it's more than just that. It's what is COVID-19 driving people to do as a result of the high level of anxiety, the high level of onset of depressive episodes, the high
Mhm.
level of helplessness and feeling like they really just don't have control of their life. Losing control can make
Mhm.
people run to substances. So they have one thing
Right.
that makes them feel closer to being in control of their reality, closer to
Mhm.
being in control of their life, closer to feeling in control of their outcome, even if it leads to their death. Like
Mhm.
at the onset of COVID-19, even myself, like we in my family, we experienced an overdose death very, very young. And it literally broke my heart. My cousin, I'm like, he's not even begun to live his life. He has small kids, you know, I think he was 21 years old. And it's one of those things that literally it breaks your heart for your family members and for yourself, because everybody's trying to figure out how to have the conversations
Mhm.
but not have the conversations.
Mhm.
And I think for
Right.
me, for the very first time in my life, I saw what that really looked like, what
Mhm.
it looks like to turn your head and shy away from the realities of what's taken this person's life. You know what I'm saying? Because nobody's willing to have those conversations, because I guess feeling like, okay, well, you're blaming the person that's passed away, or that's a dishonor and things like that. But I feel like it's a dishonor to not have those conversations, because when you don't have these conversations, we're not as aware as we should be. And as a result, proactive as we could be instead of reactive after the fact that we're forced to be. You understand what I'm saying?
Yeah, because you know, one of the thing is the thing about, you know, somebody who's really struggling with their addiction. It's important. A lot of them have sort of burned the bridges with their family, but it's really important to have the family, to have whoever, you know, family member involved in their care, because when this person starts to make different changes, the family sometimes have different reaction to that because they're used to knowing him or her in a certain way. Now he or she's getting, you know, clean and sober and now is acting different. That changes the family dynamics because and you get resistance. So part of educating this person who is struggling with his or her substance use, your family also needs to get educated because they also don't understand what John has been to. All they know is that he's grabbed their mom grandma's pocketbook, he's fight this one, and you know, he stole the money and he's took the best ring, and the TV's been gone, and whenever he shows up in the house, everybody got to hold their pocketbook. They just know that that's what they have to do. And they need education as well in understanding how what's going on for him or her and why. And that may involve some of the behaviors they have also created. You know, if this person has been through significant trauma, abuse, physical abuse, sexual abuse, you know, emotional abuse at home, it came from home. And if they have to address that to stay clean and sober, the family has to be aware that they are part of that issue. And I'm
Yeah,
telling you,
they have to be
a
accountable.
lot of substance abuse families don't want to get involved anymore because they've had to deal with all the behaviors of the person who's struggling with their use.
Do
You know,
you think that when we as African American and Black people who are identifying with this culture, do you think that when we see it happening in this culture, like it changes our viewpoints overall for like as a collective, and it changes our response in our communities and advocacy?
I don't think there's enough education for you to get like it's like the word is it's his fault, it's her fault, and that's it. You know,
Right.
um. So he died, she died. Everybody, I'm telling you, probably 1 in 5 people know somebody A affected by their substance use, B have died as a result.
And that's a good one for those of you watching on the social media feeds. Type one, press one, and type that in if you yourself know someone who is currently engaging in substance use, even if it's yourself. And then type two, if you just heard of it, if you're like a person that hasn't been directly exposed to it, but heard of it in the media, and you're only impacted by way of celebrities dying and seeing stories on the news and that
Mhm,
kind of thing. Because I want to kind of compare that dynamic, because I do believe
mhm.
like the vast majority of humanity, once reaching teenage years, has been exposed to substance use at some level in their
Mhm,
family systems. Like
mhm.
I do believe that. And I'm curious as to how people process and respond and how they think about that, especially when it comes to cannabis. And that's the one that puts me in a very curious space, because I'm just curious as to how people are feeling about it. Because what we hear oftentimes, and I know for me, I hear people say, well, I mean, smoking weed is nothing. Like
Right.
I was out here smoking weed, and I was smoking weed while I was doing the hard stuff. Like I hear that from people
For
often,
sure.
you
Well, we
know.
have a nation that's saying it's okay. It's getting legalized in states.
Right.
Yeah, absolutely.
So
And I
the
mean, in
attitude is not going to
Amsterdam, it's
change.
always been legal, and in so many other countries, but you didn't see them overindulging in the usage of it. Even nicotine, cigarettes, I
Mhm,
think even vaping, like, people don't understand the process that's taking place in their brains when they're
brain.
indulging in the substances that they're
Mhm,
using. So I think clinicians who are like integrative practitioners, who are neuroscience based practitioners, I think that we have a higher propensity to have better results on the outside, because we're able to take people through what their brain is experiencing and what that looks like inside of the brain, the physical manifestation of symptoms and functionality for them, and break that down. But even the clinicians who work off theory alone, I feel like they can still reach those people who are in treatment simply because they're in treatment. So whether you're mandated by the courts to come, or you're there because you finally reached a plateau in your life where you're like, I can't go forward because I'm constantly engaging in this behavior, and that behavior is blocking me from moving into these spaces, right? That I feel myself successful in. I feel like, you know, when those people are in treatment, I feel like they still have a high propensity to soak up what's there.
They do.
As far as like useful mechanisms to substitute for the negative behaviors and things that they can do to help remove the negative thoughts and ideations that lead to indulging in these substances and things. But I think that people, if not for anything else, I want you guys to take this from this video, because, and if you're not already sharing it, if you've not already liked and shared this content, please do it now, because I really want this message to be out there more so than anything that we have said tonight. Your brain is your central processor for all activity in your body. It's the central place that everything takes place. And it's not just the substances that you choose to introduce into your body, it's the process in which you're indulging in those things. And what happens is your brain has the flow of blood going in and out of it, and it's producing chemicals, and it's receiving information from all of the receptors, all the nerve endings in your body, and all of these different neuroreceptors and reuptake, and all of these things are responsible for doing a specific thing. So when you're breathing air in and out at a regular rate, it's balanced enough to produce the amount of blood flow and chemicals to your body in the amounts necessary for you to maintain a high level of functioning.
For sure.
When you snort a thing up, or you take deep inhalations and you hold your breath, you're doing damaging effects to your brain. So the underside of your brain, eventually small holes turn to big holes. Big holes turn to serious gaps in your brain. That's what it looks like when we're looking at a fMRI scan of the brain, and we're doing a SPECT scan analysis to figure out, okay, why are these behaviors taking place in this person? And that's the reason that your behaviors start to be affected, because without the adequate flow of oxygenation in the brain, your body can't function at its full capacity. That's why people become comatose and in a vegetated state, because what happens is now that person has gone without adequate flow of oxygen to the brain for so long that they literally have gaping holes.
And that's why when somebody comes into treatment, it's important to educate. The goal is not to be asking them, why are they doing this? How do they understand? You've got to educate, because what that does is you're giving their brain the opportunity to begin to start to take on some of this new information and rejuvenate if it could, and also get the body a chance to heal. So it's important as clinicians, when you have somebody come into treatment, the goal is not even, I don't care if your treatment is 3 months, 6 months, 12 months, 18 months. This, to know that this person sitting in front of you has to have some education before you start to take a look at other issues, because they're not going to get it. They're not going to understand it. And each drug affects differently. The heroin addict needs 2 weeks at least to rest. I'm telling you, because his bones is like is hurting. He's having serious physical stuff. The person who's been using crack cocaine cannot sit still. And that's not because he's doing it intentionally. His brain is getting used to not having that stuff in there, and it's creating a reaction. And the list will go. Marijuana is this very same process. When you stop using it, your brain is gonna they get irritable, you get angry, I mean, you'll see those
Easily
behavior, and if you
aggravated.
don't understand that, then you set your client up for additional failure. They're already feeling ambivalent because when you ask them what brought you in the treatment, they never says themselves. They'll say their wife did, the
Yeah.
probation officer did, the girlfriend did, the baby did. They hardly ever say I did. So they're struggling already. Well, they're already in pre-contemplation about this stuff. So, you've got to educate to help them move around the cycle of understanding what's going on for them. And you have to get that knowledge to understand that as well, and to give them an avenue to be able to heal physically before you start to move into other areas, because then they leave. They can't tolerate it, they leave.
Dominique, one of the questions that I had for you is, being the fact that you're servicing people that move and operate in a different way, right? Different types of communities, and you're servicing them, and you're seeing and surveying some of the responses to the loss of DMX. Of course, it's made national news. People are talking about it pretty much everywhere. I'm curious as to how many people felt like it hit home for them, like it was a family member. How many people have you treated that felt that way?
I am in a predominantly white area. And it's not that they don't listen to DMX. It's a different vibe, a different feel. I do have a couple of people who have talked about it, and it has really hit home with one of my patients. The idea that this man was getting clean, something happened, there was a relapse, and being heartbroken. Like, music is therapy. I love music. Any client that I've ever had, I will always ask, what's your mood, what's your vibe, what's your music vibe today, and we'll listen to it, depending on the client, of course. But we're just in session talking about the music and his legacy, and I felt like that was necessary for him to process, because I didn't have to bring it up. It's something that he brought up. I struggle with substance abuse, and I'm struggling right now with this idea of one of my role models. And I mean, it was just really heavy. But I don't get a lot of people where I'm at that really talk about it. I think it's a lot of stigma. I hate the idea of, well, you just shouldn't, they shouldn't have used in the first place. That's the worst idea you can have with anybody walking into your office.
Lack of education.
Exactly.
Yes. So I haven't had a lot of people. I think right now, a lot of stuff is heavy in our community with the George Floyd, Derek Chauvin trial. So it's just a lot. It's a lot going on in the world, just in general. So, and a lot of people don't think they can talk about that stuff. I invite my clients to talk about anything they want to talk about. If you bring it up, or if it's on your mind, then it affects you in some way. So bring it up, talk about it. So maybe people aren't brave enough to bring up this hurt me. Like when Kobe Bryant died, there were people who just couldn't, they felt bad because people would say on the social medias and things like that, well, he was just a celebrity. You never knew him. And it's the same thing with DMX. I didn't know, you don't know him, but you feel for him. You feel for that family. It's something in your heart. So you should bring it up. So,
and because one in five people at least have had some connection with either having family members or some friend involved in substance use. They can identify with that more so. We can identify, not just that they're celebrities, but we can identify with it because we've been affected by it.
For sure.
Even with the George Floyd trial is about, the whole case is about, did the drugs kill him as opposed to what the police officer having his feet on his neck. That's what the jury now has to decide on. Did the fentanyl kill him? Did the methamphetamine kill him? As opposed to what the police officer did that everybody saw on camera, on
And I am
TV.
being triggered. I'm being
So,
triggered right now.
well, but
I'm looking at those trials. I am being triggered right now because of that. Well, did the
Yeah.
fentanyl? No, the knee on the neck killed the man. But you know what? Let's do it.
Well, the medical doctors make sure they made sure they talk about that. But what I was saying is everything, there's drugs involved in a lot of what's going on, because people have this hole in their soul that they're not getting filled, and they're reaching towards substances of all kinds, because shopping is a substance. Eating is a substance. I know I keep hitting your shopping thing, Doc, but we both on the we're right there together with the shopping.
All my triggers, like I'm telling you, my coping mechanisms are shopping, more shopping, work, reading. I feel like even myself, like when I find myself having to check myself, because I'm a person who believes in honest self-evaluation on a consistent basis. So about every week, I do those honest self-reflections. I think Dominique said a mouthful when she just said that she was being triggered by the case, because I did want that conversation to kind of shift there. I think that the reason that I mentioned the effects of this particular loss of DMX, timeliness of where it is, and all of that, the reason that I mentioned that is because I think there are a lot of things that we as a Black community are missing in the media. There are a lot of things that we're missing, kind of like when we're looking at what's being covered. We're not acknowledging there's a lot of ownership that needs to take place in our community. I think that we need to start acknowledging the fact that there is a real substance use issue and it's gravely affecting us. I think that we need to acknowledge that there are dire consequences for our young Black men and our young Black women when it comes to substance use. I cannot remember the young lady's name in Tennessee who shot the police officer and then subsequently was killed when he was just simply trying to do his job. These things, and the way that I feel about the way that these things are impacting our community, and how we need to really take a deeper look into who we're becoming as a society when we overlook the atrocities that we inflict on us. The media is giving us a picture. It's giving us a picture that looks like we're victims, so that we can lack accountability and we can look away of being accountable and change behaviors in the way we move. And I feel like if we're looking at this full circle, for me, all of this started, like I said, last year. I did a lot of advocacy behind the Nathaniel Woods trial and his conviction to die. He was sentenced to die for just being in a room while a police officer was executed during a takedown drug bust. He was executed. He was sentenced to die, and you had police officers that testified at this trial as to him not having any weapons, as to him having no involvement whatsoever in the police officers being shot. He was doing drugs in a trap house, and he was arrested because he was there on the scene doing drugs while a drug dealer murdered a police officer.
Wow.
He was sentenced to die for capital murder. He had nothing to do with it. I think that we have to look at the lifestyle that comes with the substance use. That is the eradication of our race.
For sure.
These are things, when we're looking at the George Floyd, which was a couple of months after they executed Nathaniel Woods last year. They executed him last year in March. You have a racist governor that refused to order a stay, give this man a new trial. You had these things happen, and I was just absolutely torn. I'm like, you have police officers that were there to testify that this man had no intent and didn't plot, didn't do anything. He was just minding his own business, using substances, so it's illegal. But still, You're trying him for capital murder. You're going to convict this man to die. And the person that killed them, that confessed to killing the cops, served a life sentence.
Wow. Horrible.
This world that we've created around using substances, we have to take accountability for that. And we have to do the things that we need to do to change the way that our young people think, feel, move, and simply are being cultivated. We have to do that work. And I feel like as clinicians, that's what we are tasked to do. We're here to help people see the cycle that they're actually in so that they can adopt new behaviors. And so it takes being honest with yourself and your reflections, like even though we may think it's something light to have like shopping addictions and being a foodie and my 600-pound life, you know, like these are real things too. Some people will eat themselves to death.
It has life damaging consequences.
Yeah.
When you hit your rock bottom, you've lost your house, your credit, your significant other, your kids, and your family have abandoned you. You are sitting with you. And
Hey,
some people.
Shanae. You guys say hey to Shanae. She's
Hey,
a
Shanae.
clinician that's here in
Hello.
Georgia as well.
Oh,
We got to get you on next time. But
Okay.
yeah, I there is just so much around this lifestyle that has led to the death of so many people that we know in the media, and so many people that are in families, and suicide, accidental suicide by using substances in insurmountable amounts, thinking that you are beyond death. I
for
think
sure.
that we have to do something to help people just basically understand how this has become Black culture,
Right.
and that is
And
not a good thing.
that's true. And I think I understand enough that I know how drugs at least how crack got into a community.
Mm-hmm.
But and that's we know how it came into a community. We didn't bring it in.
Mm-hmm.
It came into our community for a purpose, because others recognized that hole in our soul that we
Yeah.
had, and they said, ah, we know how we're going to fix this for these Black people. Introduce crack cocaine. Now what has to happen is we now have to do some work to fix that for us,
Yeah. We have to
because
get
our
away from the
children shouldn't be
mindset that that's a
growing up.
necessity.
We shouldn't have an addict, a kid who's addicted at age 8 or 9, or born addicted
And
and
it's
walking
sad.
around with a weapon in his or her hand because he or she's selling the very stuff that is killing the community.
I agree. I feel like all of that, like when you say knowing who bought it into the community, I think there are levels to that too. I feel like when we start being the type of people that are, because I to be honest, I've always been, like I talked to you guys about, I've always been exposed to people who use substances. That was never something that wasn't I mean, right in front of me. And I mean, the whole crowd's doing it and I'm just sitting there looking. I had zero tolerance for that stuff entering my body. So we have to be, and that was even as a young teenager, we have to be the type of people that say, just because the rest of the world is indulging, just because the rest of our friends, the rest of our family is indulging, just because everybody else is doing a thing doesn't mean that I have to participate in that thing.
Exactly.
We have to be accountable to ourselves before anybody else, because we can't help other people if we're not helping ourselves. And what broke my heart about George Floyd is that you have a coroner who has, before even seeing all this, ruled this man's death as a homicide. And that one, you want to overlook that because he had a substance use issue. But guess what? If he never had a substance use issue, and this is a hard one for us, if he never had a substance use issue, he never would have been in that situation.
I totally agree.
Where, and it's
Totally agree.
because it's a part of the lifestyle. And
Right.
it breaks my heart to see and recognize these truths. Like, you have no idea. When I was thinking about what's happened to Nathaniel Woods, I couldn't help but think, where are the people? Where are his family members? Like when he's going to this house, and the thing that resonates the most for me when I say that is, did you guys watch the video of DMX's sister Roxanne?
No, I didn't see that.
I figure I'm going to play that video for everybody to see. I already put on there the fact that we were gonna use media that is fair use policy and things like that. But it's a short skit, and it's what she released after having heard about the loss of her brother. And for those people who are out there watching, I'm going to say viewer discretion is advised, because she does talk about some things that are very sensitive to the lifestyle that they led, the traumas that he endured, the life that he endured, and some of what makes this a culture for us.
Yeah,
And,
I've seen
and
some
that's
of
the
that.
part that really I want people to focus on, because this is definitely a culture, and it's become Black culture. And more important, after you listen to this, we need to look at the fact that this has become the lifestyle of that affects the Black community in insurmountable numbers, because of foster care, DFACS involvement, and that sort of thing. So I'm
Well, I
going
think
to
it affects both, not just the Black culture. I think what's getting portrayed mostly is the Black culture.
I totally agree. I totally agree. I think when
'Cause
it affects the European Americans, then it's a pandemic, it's an epidemic, it's something that needs to be addressed immediately. But when it affects the African American communities, it's almost a crime, right?
how do
it
we
So
how
there's
do
is.
we
something about
respond?
And I have worked at enough treatment program where half the population were also Caucasian. So it affects them too. What we see is, what the media chooses to give us. But addiction,
yeah,
there is no barrier.
I
There
agree.
is no barrier. I mean, it affects everybody. I don't care what your race, what your ethnicity is. I mean, my ethnicity is I'm West Indian. If you haven't figured that out from my accent. So, but I grew up with that stuff. So I mean, I know because my
Let me
family's been affected by it. So,
Okay.
this is this whole addiction stuff affects everybody and it crosses barriers. How
it absolutely does.
it
So
crosses barriers.
we're gonna play this video. This it's about 8 minutes or so. And this is again DMX's sister Roxanne. She talks about her experience with him from the moment that they came into one another's world, and what his life in the foster care system and then moving into the music industry and things like that look like, and the impact on his world. And this is, I think it was Susanna earlier that said something, or Dominique, when they were talking about the fact that those family members going through that experience, sometimes the
Mhm,
family members give up.
mhm.
And this is kind of, I want you guys to really listen to what she had to say um in this video. So I'm gonna hit play.
let me tell y'all something. And this is one of the most serious things that I've ever said. Maybe even one of the most emotional and personal that I've ever said. And it has to do with DMX, and it has to do with his passing. But not only his passing, but his childhood and what he has went through. What we had went through. Now, my relationship with DMX, we wasn't super close, but we had time enough to be able to talk to each other. And coming from similar backgrounds, there's certain things that I need y'all to understand. And this is not what somebody told me, this is what he said to me. He said, when he was younger, his mom had took him to a children's home and said that they was just going to visit, and she left him there. She took him there and she left him there, and he was too little to be there, too little to understand how to defend himself, how to take care of himself, and everything else. But he did it, and he survived it. And we all have our ways of dealing with it. I've been through that system. I've been through that. I know what it's like when people think that adults don't care about children. I know what it's like to run the streets, sleep on the train, sleep in the hallways, try to sleep at friends' houses, have people tell you could come stay at their house, and their brothers are trying to mess with you, or even their fathers and adults and uncles and shit. I know what it is like. And we all handle it differently. We all have our demons. When people would see me and say how angry I was, they didn't understand what I had endured and what I went through. And as soon as me and DMX came in contact with each other, as soon as me and Earl came in contact with each other.
If you are sick of paying too much money for electric bills and you have a mirror that looks like this in your home, you can get paid today to.
We already knew what was done to that spirit. And it makes you overly aggressive. It makes you seem angry to people. It makes you seem mad to people. So people try to find whatever they can in order to overcome that. Some people turn to drugs. Some people turn to drinking. Some people turn to other things. People wonder why we give so much. The money that I make now, right? I give most of my money away to children who are in foster care and going through situations. You know why? Because there was nobody to do that for me. There was nobody to do that for me. So I do that. I give back. I try to make everybody happy. I try to keep everybody good because of what I may be dealing with on the inside. Everybody is fighting their own fucking demons. So when I think about it right now, I think about the fact that when that certain amount of peace comes along, why do you think, let me tell you why Roxanne Shante don't drink or don't use drugs. You know why? Because I'm so afraid to find some fucking peace in it that I would never stop. I'm so afraid to find some fucking peace in it. I still now fight with going to sleep. When I'm up and I'm posting 3, 4 o'clock in the morning, I'm not happy that I'm up 3, 4 o'clock in the morning posting, knowing that I got to start my day all over again. But that's because when you go through those systems and you go through that, you learn how not to sleep. You learn how not to sleep. So you up, and every time somebody shows you the least little amount of some type of deceit, or you catch somebody wrong, you so quick to let go because you know that as soon as you let your guards down, as soon as you trust somebody, something bad can happen. Something really bad can happen because you've done it. To miss out on a childhood, and then people wonder why you make the mistakes you make. Yeah, I make mistakes all the time. And they say, oh, you probably suffer from arrested development. Oh, you probably have this, you probably have that. No, I went through some fucking shit too early in life. I went through it when I wasn't supposed to. That's what it was. I went through it when I wasn't supposed to. And it's just so hard when you see people saying mean things and doing mean things, and even when you online and people are posting and saying negative things and saying all this other foul shit, you learn to just see past it. You learn how not to you get a tough skin because of it. So my heart is hurting right now. But in a way, I know that he has found some fucking peace. I do. And I'm saying this right now because for all of us who have experienced it, for everybody that's been out there that has went through the foster care system and had a bad experience, because I'm not going to say all foster parents is bad, because I have a sister who's a foster care parent because she wanted to be one of the good ones. When you have been a check child, that means they take them and they take you in their house because they only want a fucking check. And then you go into this fucking hip hop field and they only fucking nice to you because you're a commodity and you making them some fucking money. It's like this cycle never fucking stops. It just never stops. Oh my God. So just know that there were people that were out here that were trying to help him, people that he could talk to, but you can't, nobody can fix what is unreachable inside of you. And it's just rough. And I just need to say that. So if you know a child and you see a child in foster care, or you see a child that's going through something, man, help them. Say something. Say something to their parents. Do something. Because you never know who that child is going to grow up to be. You never know who that child is going to grow up to touch. You never, ever know. You just don't know. And you just don't know. So I'm just saying, anybody that has been through it, I know it's hard, and I know that you're dealing with it, and I know you done seen enough social workers to save you a lifetime. But maybe there is some type of therapy you get. Sometimes it's not even about wanting to grow up and be rich and have money. That's not it. It's not wanting to grow up. It's about wanting to find some peace, some happiness, a family that is yours. That's what you really want. That's all you want. I took in kids because I wanted kids to feel happy. I wanted them to feel a place that they could go and be loved. And yeah, my mouth may be foul, but they know they would never be hurt. They know they would be fed. They knew I would share my last. That's all you want. That's all you want. That's all you want. So I needed to say that. I just needed to say that.
That's some heavy stuff. And she
It
was
was.
talking about that hole in the soul that we have. If we don't get it, taken care of, if we don't get it addressed, if we don't have, clinician who can help you get to the place where you can fix that, then what's going to happen in our community is this continuous need to fill it with stuff that has life-damaging consequences.
I agree. I think the part that hit home for me is the fact that this was a childhood trauma, right? This started in childhood. Our children are being sharply affected by many, many things, and they're ending up in places that are not safe and healthy for them, but they're being removed from their primary caregivers. That's the part that stood out to me.
Mhm.
And also shout out to you, social workers. Uh, look, I'm just gonna, you know, I'm a marriage and family therapist. I'm so not a social worker, but yeah, no, seriously. She mentioned that it might be a social worker or somebody or a therapist you could go to. Social workers have a huge history in treating chemical dependency. And that's really it did something for me. It does something for me when I hear people refer, after having been in these types of experiences, refer people to adequate help. Um, and God, the part that really hit hard for me also, Tanyetta, was definitely the fact that we have a system that's broken.
It's broken.
We remove children from their primary caregivers where we say that they are not meeting the needs or the standards for caring for their children. And when we remove them, they go to places where they are abused,
Yes.
where they're used, and further
Yes.
attachment trauma and other physical trauma, sexual traumas happen.
Absolutely.
That was heavy. It was difficult for me to watch it the first time I watched it, and definitely difficult for me to listen and watch it this time, simply because I feel her pain.
Mm.
And it breaks my heart to know that we've lost somebody like this. And a lot of people look at the fact that Earl was a womanizer. He has a history of abuse and, abusing people. Well, look at where he came from. And that's not to make excuses for him, but that's to help us get a picture, a good understanding
Mhm.
of what this man was combating every single day of his life. And you
Right.
see that this woman is saying, yes, he had people in his life that were trying to help him, people that have been through these experiences, but not in the way that he has. Nobody knows
Mhm.
that person's experience. And so, to those people out there who are struggling with any type of substance use issue, um, please, please, please get adequate help. If you do not know where adequate help is and you are anywhere in the world, dial 1-800-273-TALK. I listed that under this post because they can provide you with adequate linkage and resources, connect you with a therapist, connect you with a
Mhm.
peer person on the line, and do a warm handoff immediately. Even if you just want to talk and it's like 2 in the morning and you have a therapist,
Mhm.
and you don't know whether or not that person's going to answer the phone when you call in a crisis. Even if you don't know what a crisis is, dial the number.
For sure.
Yes.
So that's all I got. Um, I am Dr. Lakiana Jefferson, doclqj, anywhere on the internet, and I'm here for it. Okay. If you guys need help, if you need linkage and resources, contact me. If you can't, contact them. 678-468-0442. And I'll let these lovely ladies do their outros. And that's all I've got. Rest in peace to so many of the souls that we've lost to
Mhm.
substance use and related issues around substance use. And my heart goes out to the families.
Absolutely. If you haven't done so, go ahead and follow at IPCS Indiana on Facebook, Instagram, and Twitter. My contact information again is on all my social media platforms. I so appreciate everybody for listening. And I'm going to thank you all in advance for just loving your neighbors, loving the people who are struggling just in general, because that love can go a long way. That empathy can go a long way. And Dr. J, she admitted her love for social workers today. So
Oh my goodness.
if you have not gotten yourself a social worker, get on that. If you are
There
in
you go.
Indiana,
That's right.
I am a licensed clinical social worker in Indiana. Again, if you don't have you a social worker, you better find one.
Or an MFT, a marriage and family.
Wait a
That too. That's right.
minute.
You know.
Okay. But no, I appreciate the time and I appreciate being invited to the panel today. Looking forward to many more. So peace, love, and all that good stuff.
Yeah, thank you. Thank you, Dr. J, for Dr. Jefferson, for having me on with you and Dominique, LCSW, and Tanyetta. I'm Susanna Stone. I am in Atlanta. You can reach me at www.ssrecovery.org or 470-651-6704. If you're looking for support around addictive issues or trauma issues, feel free to reach out to me. And
Or an
I've got this
amazing
thing
clinical
about
supervisor.
what's that?
I said, or if they're looking for an amazing clinical supervisor,
Thank you.
it'll
If
be
you're
cool to
looking for
have
amazing
yourself,
supervisor.
Dominique, as well.
Mhm.
Chanel's not on here, but Chanel's also a clinical supervisor for social workers. Those folks are amazing, even though they're social workers. It's not their fault.
Child,
But I just wanted to say I've got this little saying that Confucius says, right? If you cultivate the roots, the branches and the leaves will take care of themselves. I think that's what we do as social workers and LMFTs and LPCs. And there's one more LMHCs. I want to make sure I say it correctly.
Yep,
We
yep.
all therapists
Shout out to
we
those
all
folks.
therapists in this. And there's nurse clinical specialists too. They're also considered therapists. So, if we cultivate the roots, we firmly believe that you are in that position to make changes for your own self. Because you really are the one, she says it. Nobody knows, nobody can fix that thing inside of him but him. he's got to, he'll get support from us. So if if you're looking for any kind of services in Atlanta, feel free to reach out to me. I appreciate for all the ladies and gents who's out there listening to us. Send us your comments. We will certainly respond back to each and every one of them. Right, Dr. Jefferson?
Mm.
That's
And
right.
thank
We
you
will be
for
on
being
it.
part of our audience.
Yeah, we will let the social workers get on top of that because that's what social
Ah.
workers do. Just in case you guys didn't know, they like to write books.
Mhm.
Get out here.
Yeah, right. Mhm.
Tanyetta.
Well, thank you for having me this evening. Thanks, Dominique and Susanna. Please follow me at LECS Heals at Facebook, LECS Instagram at Tanyetta Speaks, on Twitter. I can be contacted at www.therapistforyou.org. I am LPC as well as clinical substance abuse counselor. For all of you out there, be encouraged. If you know somebody that's in need of help, please help them as best you can.
Mhm.
Good
All
night.
right. So thank you guys for listening.
night.
And another big thanks to my panelists today. If my last thing in wrapping up is if you see something, say something. We have to
Yes,
stop being the kind of community that says snitches get stitches and start saying if you see something, say something. Because if you don't say something, nobody knows nothing.
absolutely.
So that's all I got. And I hope that you guys are living well, being well, and taking care of one another. Love each other and be thankful for the time that you have with the people that you have and the energies that you've been, allowed to have a part of and play a part of and all that stuff. So that's all I got, folks. Later days.